What is up, Smashers? It is Tuesday morning. We got awesome stuff coming on, but you know that. It's always awesome stuff coming on. How about some mid-back mobility? Listen, I'm gonna put this in here. I'll put this caveat in there. It's weird how my camera gives that. All of a sudden I look like I'm in a Western, funky little color on the camera. Sorry about that. So anyway, thoracic spine, for all you guys that did 17.1 or are redoing it since they extended the deadline till today, your mid-back. That's what I hear a lot of people, mid-back, hamstring, traps, all blown out. If your low back's blown out, you were hinging at the hip and your snatches were a little questionable. So that mid-back, that thoracic spine is designed for rotation. The lumbar spine is designed for that extension and flexion. And here's the problem. Most people, it's the opposite. So the thoracic spine, right, it works in the transverse plane. And what's supposed to happen is those vertebrae are supposed to smoothly move back and forth. And you're supposed to have that extension a little bit in your thoracic spine. You're not supposed to walk around like Quasimodo. The primary movement though is rotation. And then the other part is that it's going to protect all the stuff in guts and heart and lungs and everything else that's going on in here. And then it's also an anchor for the rib cage. So think about this. If your thoracic spine doesn't move right, the ribs don't, there's no excursion of the ribs. They don't move properly. They don't open and close the way they're supposed to, which means the hinge at the front on the sternum and the back on the transverse process doesn't work the way it's designed, which means you can't expand the lungs, you can't get enough oxygen, and your breathing suffers, which means your metcons suffer. A lot of stuff suffers. If you can't expand your lungs and get all that oxygen into the lungs or blow out all the toxins that you're drawing out of the blood and pulling into the lungs, you're gonna have all kinds of bad things. The other thing is this. I know, I see you, Jess. I say that all the time because Jessica Fitzgibbons, if you don't follow her, by the way, give her a follow. She's a badass athlete and a good friend. She always harasses me about moving my camera around. So what I'm going to tell you is if the thoracic spine doesn't move properly, the overhead position doesn't work properly, so now you start chewing up the shoulders. And a lot of times what happens is we have something called the anterior longitudinal ligament. It runs down the front of the spine, and it doesn't allow that thoracic spine to open up the way it's supposed to. And then we have muscles inside, rotatories, multifidus, all the paraspinals, even the lat, the teres, the subscap, all the stuff that I talk about all the time, get all glued down, and you get into this really awesome position. How many people have you seen, say around 50, 60 years old, and they go like this, and they walk around, they go, I remember when I was your age, I used to be able to do all that stuff. Guess what? That's not normal. So if we can clear out that gnarly mid-back pain, like somebody stabbing you with a butter knife. Why a butter knife? Because it hurts more. It's like a spoon from that Kevin Costner movie, the Robin Hood. Somebody told me about this. One of my patients actually brought it up and said, Robin Hood. And he says, I'm gonna carve his heart out with a spoon. And his buddy says, I think it's the sheriff of Nottingham, says, why a spoon? He goes, because it hurts more. That's why. So anyway, we want to pull that out of the back because it sucks and it's chewing up all the tissue in the back and it's making you really uncomfortable. Never mind its limiting motion. So if you move around like a piece of cinder block or a rebar or whatever you want to call it, we're going to fix it. It's just that easy. So we're going to do three things. We're going to clean up that tissue. I'm going to show you how to get some rotation in there and how to get some extension into that thoracic spine in a super funkadelic way. So number one is let's regain some of that rotation. You're going to need a band. So you grab your band, cinch it up to the rig, doorway, really small person, the leg of your spouse, and it doesn't matter, whatever. You're gonna come all the way in. So now I've got the band wrapped around. So it's around the elbow, wrap around, grab the back of your head, get into quadruped, and now you're just gonna resist the band, come down, open up, down, and let the band drag you open, down and up. And you're gonna do 20 of these, each side. That's numero uno. Number two, I want to make you look at my shoe. What's really funny is that rhymes, and that wasn't even the intention. So you're going to take a piece of PVC or a foam roll. We can take our foam roll of beading, that's fine. I would prefer a piece of PVC because at Home Depot, these things are like $1. You can have them cut them down. You probably even find a piece that's just kicking around. You just go up to the guy and shoot him a smile and say, hey, can I have this? And the guy go, yeah, sure, why not? So you're gonna give yourself a big hug. No weight, absolutely nothing. Get that PVC tucked in there. Yeah, use a PVC. I'm gonna retract the foam roll thing. Use a piece of PVC. You know why? Because it hurts more and it's more effective. Give yourself a big hug. And now you're gonna extend. So I'm picking my hips up off the ground and I just wanna hunt around in all those little gristly spots. Oh. Now here's the trick. Once we've ground out this tissue and turned it into nice, soft, well massaged leather, we want to extend and just open up that thoracic spine. You can put your hands on your head. You can put them all the way overhead. It doesn't matter, whatever you want to do, but I want you to extend over that thoracic spine. So mash it out and then extend for how long? 2 minutes. That's number 2. Number 3 is the best one. This one is awesome. You know why it's awesome? Because it is probably the best thoracic mobility that exists, and it's really easy to do, and it's not only gonna hit your thoracic spine, it's gonna hit your lats, your triceps, and everything else that's all sticky and grisly and stuck down. So you wanna get rid of that office chair mid-back pain, do this. Or that post 17.1 pain. And I know there's a lot of stuff out there, so whatever you choose to use is fine. You're gonna grab this chin up grip. This is the fun part. All you're doing is bringing your arms all the way up over your head, bring your torso back, and just push yourself all the way down. Now here's the trick. I'm in this position, I'm gonna round it out, and then I'm gonna go into extension. So I'm gonna do flexion, extension, and I'm gonna do that for how long? 2 minutes, ninjas, and that's it. That's your thoracic mobility for the day. That's how you smash out the thoracic spine. That's how you regain that rotation. That's how you unglue all that stuck tissue. That's it. I'm Trev, SmashweRx. Check you guys out tomorrow. Have an awesome day.